Happiest New Year to each and every one of you on the channel. I really hope 2023 will be a blast for every one of you. Grab your piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at medical topics in depth. Today we're going to be looking at imaging, medical imaging. So we're going to look at CT scans. I already started with a prelude, an introduction to CT week. So we shall continue now and start looking specifically at head pathologies, and we shall start looking at CT head. This is actually part 1. It shall be divided into separate important parts. Note that this will not be an exhaustive thing, and it's only to help you understand the basics of CT scans, such that in an event that you don't have a radiologist or a radio technician to interpret the CT scan for you, you can still have an idea and still manage your patients accordingly. If you haven't yet subscribed to the channel, please subscribe to the channel, hit the bell notification icon to be receiving notifications of such videos every time I post. And let's jump right in. So here's our warm-up question. So the classic pattern of chronic ischemic stroke on CT brain image is A, hypodense lesion with dilated ipsilateral ventricle, B, hypodense lesion with dilated contralateral ventricle, C, hypodense lesion with midline shift, D, hyperdense lesion with effacement of the cortical sulci. You may pause the video at this moment. Write down your answer, scream it at your screen. I will give you the answer at the end of the lecture. So remember that CT scans and MRIs, we shall discuss MRIs on their own, but we shall use MRI imaging to actually help you understand the anatomy, so that when you look at the CT scans, it's much easier for you to relate and have that picture in your mind. But these imaging modalities are actually performed to assess many brain disorders. MRI actually is the investigation of choice for most of the indications. And the two most common exceptions for where you get a CT scan as opposed to an MRI is if, number one, you have acute trauma, or number two, if you have suspected acute subarachnoid hemorrhage, then you would want to do a CT scan. Now, depending on the type of abnormality that you have on the CT scan, you may get two things. You may either get it appearing dark, what we call low attenuation or hypodense lesion. This is very common with the acute cerebral infarct. So they show low attenuation compared to the surrounding brain tissue. So they'll be darker, grayer than the surrounding tissue. This is due to the presence of edema. Then you can have a bright lesion, or we can call this as a high attenuating lesion or a hyperdensity. So this is seen with acute intracranial hemorrhage. So it's typically bright on the CT scan. Now remember that attenuation on the CT scan, like I mentioned in the previous lecture, if you haven't watched that, please head over there, is what is measured in what's known as Hounsfield units. So if you have the cortical bone, it's going to appear white, so it means it has a high attenuation value, or it has a high Hounsfield unit value. Whereas air within the paranasal sinuses is going to appear dark or black because it has a low attenuation value. So it means that the cerebral white matter is going to have a slightly lower Hounsfield number than the cerebral gray matter. And so it's going to be appearing slightly darker than the gray matter on the CT head. This is very, very important for you to note. So here's a normal CT scan of the head. Remember that when we talked about the chest x-rays, we had a very few contrasts on the chest x-ray. But then in the CT scans, there's a wide range of variations. You can see bone, muscle, blood, contrast, the brain matter, gray matter, white matter, edema, CSF, fat, and air. So these are the different contrasts that you see on the CT scan. I just put this picture of an x-ray to remind you of the different contrasts on the x-ray. So now let's look at the CT image over here. So here you have the details of the patient, the name, the date of birth, the date of the study, and then of course a few other details there. So let's just get our bearings straight. So remember, the patient will be lying flat in the machine. So it means this part here is the front part of the patient, the front, the anterior part. This part here is the back part, the posterior part. And remember, whatever is right is left, whatever is left is right. So this is the right side of the CT image. So this is the right hemisphere. And then this is the left side of the CT imaging. So this is the left side. Then of course here you have the slice thickness and details of the slice that you have taken of the CT scan. So this is a normal CT scan of the head. So the contrast or the window or the brightness or the level of the CT scan actually can be adjusted to highlight particular tissues. For example, if you want to view the brain at a much more detailed manner, you can actually adjust the contrast or the brightness, which is what we call the window and the level respectively. I'll show you a picture of two CT scans taken at the same level but with different windows. So the CT scan is going to be consisting of images that are adjusted, of course, to emphasize soft tissue details. We call that as a soft tissue window. So you can have a soft tissue window where it's just going to emphasize soft tissue details. You can also have one where you want to visualize the bone details. You call those as bone windows. So you have soft tissue windows, bone windows. Remember, we had a mediastinal window and chest windows when you talked of the different windows in the chest in the previous lecture. Like I said, if you don't understand this, please watch the previous lecture. It will make sense. So here is an example. So this is a normal axial head CT image. So you can see that this one here on A is taken for you to visualize the intracranial contents. So as you can see, you can easily see the intracranial contents. You can't really see the details of the bone. So this whitish area here, this is what we refer to as the bone. Then this is of course the brain. Then on the other aspect here, we have the bone window, where now you are visualizing the bone in much more details. You can't really visualize the brain in details. And there are other images that you can actually, or other things that you can visualize here on this particular image. As you can see, if you follow the black arrows, so there's black arrows here, that's where you have your thalamus in this area. This one here, this double arrows is the thalamus. Then this single arrow here is going to be your internal capsule, where this arrow is posting. I'll show you a much more detailed thing that's there. Then you have the CSF frontal horn over there on the left, lateral ventricle. So this is what's shown by the white arrow. And then of course the skull bone, which is shown by these arrowheads. So the same thing is being depicted there, the skull bone, which is being showed by the arrowheads. So the CT scan actually can sometimes be given with contrast, or sometimes can be administered what we call contrasted CT scans, as opposed to the plain CT scans. So contrast can be either admitted, or rather it's going to be administered intravenously. It's going to be this iodated contrast. And this actually can be used especially when MRI is contraindicated or it's unavailable. And what contrast is going to do is that these agents are going to cause certain pathologies to light up, quote unquote light up. So it will enhance normal blood vessel patterns, it will enhance the dura sinuses, as well as other intracranial structures that lack a blood-brain barrier, because if they lack a blood-brain barrier, this contrast will be able to seep in through. So things like the pituitary gland, the choroid plexus, the pineal gland, they'll light up when you give contrast. So you'll be able to see certain pathologies stand out even much more when you give contrast, as opposed to you having a plain CT scan. So for example, pathological conditions that can interrupt the blood-brain barrier, such as tumors, neoplasms, infections, cerebral infarctions, these are going to demonstrate enhancement after you give the contrast material. And it's for this reason that without a contrast CT, they're going to be invisible on a non-contrast CT, but they become very obvious when you give a contrast CT. So things that are going to increase the contrast, or things that will increase CT brain attenuation, they'll stand out more. Things like acute hemorrhage, calcium, contrast itself, and metals. What would decrease or cause hypodense lesion? Things like ischemia, infections, neoplasms, trauma, edema, and hemorrhage. Pretty much old hemorrhage. Acute hemorrhage is going to be hyperdense. Old hemorrhage is going to be hypodense. So what are some of the common indications for us getting a CT head? You can have tumors that will show metastatic lesions, for example, meningiomas, gliomas. You can have headaches, could be one indication for you to do a CT scan, recurrent headaches. Circulatory pathologies like cerebrovascular accidents, aneurysms, atriovenous malformations. We'll look at a lot of these images, especially of cerebrovascular accidents. We'll talk about it in details in another lecture. You may also have inflammatory or infectious conditions like meningitis, abscesses, toxoplasmosis, degenerative disorders such as brain atrophy, trauma, which is the epidural, subdural, hematomas and fractures, which we'll look at in the next lecture. Then you may have some congenital abnormalities, hydrocephalus. So this is just some of the common indications to why we order CT scans. So here's some anatomy, just some quick anatomy to help you remember. Remember that the brain is divided into different types of lobes. So you have the frontal lobe over there, the parietal lobe, and what's the demarcating factor here is this is known as the central sulcus. So there's a frontal lobe, there's a parietal lobe. Then you have the parietal lobe, the occipital lobe, and of course the temporal lobe here. Here you have your sylvian fissure. Then in the brainstem, you have, of course, the pons. The midbrain cannot be seen here. You have the medulla over there. Connected to the pons, you have the cerebellum, which is over there, just connected to the pons. So as you already know, the medulla is going to be responsible for respiration, heart rate, and as well as it's the continuous with the spinal cord about 2.5 centimeters below. Then the pons are going to be relating information between the cerebral hemispheres and the cerebellum. And of course, the cerebellum is going to be involved in muscle coordination and balance, things like walking, writing, those fine motor movements. So how do we interpret CT scans? So remember, just before you start interpreting any investigation, always make sure that you check for the following things. So make sure that you have the correct study, meaning the type of CT scan that you're looking at, the indication why you're looking at the CT scan, and the level the CT scan was taken at. Preferably, you can also comment on the window, the type of window that you have. Then you check for the patient details. This is a CT scan of such and such a patient, aged this, was taken on this particular date. So check the date of which the CT scan was taken, and preferably the hospital details, the file number, to ensure that you have the right details for the patient. Then ensure that you're looking at it correctly. So the right side should be turned on the right or wherever it's supposed to be. The left side should be where it's supposed to be, and the up should be where it's supposed to be, down should be where it's supposed to be. So get your bearings straight. Then comment on the quality of the scan. Is it a good quality CT scan, or does it have some artifacts on it, or it's a poorly taken scan? Then we can actually use a mnemonic to actually check for certain pathologies on the CT scan. We use this mnemonic so that we don't miss out anything on the CT scan. So blood can be very bad. That's the mnemonic. Blood, B for blood, Ken for cystins, B for brain parenchyma, V for ventricles, and bad for bones. So you remember that the bones are the last thing that you check. So you check for any blood on the CT scan. You examine the cystins, the different cystins in the brain. You examine the brain parenchyma to see if there's anything. And remember, you're comparing whatever is on the left to whatever is on the right. Then you look at the ventricles and you look at the bone. If you see a pathology, you should comment on the location, you should comment on the density, you should comment on the margins, you should comment on the effects, the associated findings, temporal progression, and as well as give a differential diagnosis. Of course, you will get to learn more of this when you look at the different pathologies, and we'll be commenting on the different pathologies on the CT scan subsequently. So this is just some anatomy. I decided to add MRI scans here for us to learn the anatomy, so that when we look at the CT scans, as we carry on to do the pathologies, it will be a whole lot easier for you to actually understand. So don't say, oh no, why are we doing MRIs when it's a CT scan lecture? This is only to teach you the anatomy. So this section here, it's taken at this is of course your sagittal, or rather coronal section. Is it sagittal or coronal? Sagittal. It's a sagittal section. Sorry. This one is a sagittal section, and then this one is a cross section. So this one is going to be cut right at the level of the foramen magna. As you can see, here is the spinal cord over there. You have the medulla here at the lower half. You have the pons over there, and you have the midbrain over there. Here you have the cerebellum, and of course here you have the hemispheres of the brain. So coming from posterior, remember this is posterior, this is anterior, this is right, this is left. So coming from posteriorly, structure here, this roundish grayish structure that is there is what's known as the cystin magna, which is going to be lodging the spinal cord. So this light gray thing in the center is the spinal cord, the cervical spinal cord. Then of course, if we move anteriorly here, we come to this, you see this dark space. Remember, we say that air is going to be appearing dark on the MRIs, it's going to be appearing dark on the CT scans. So number 5 here, of course, this is the maxillary sinuses. So this is at the level of the maxilla. As you can see here, it's at the level, this is the maxilla bone here, and of course the nasal bones inside there. So at the level of the maxilla, so it means these are going to be your maxillary sinuses. And of course, this image number 4 is going to be pointing towards the mandible. Then we move a bit higher. This is now being sectioned at the level of the medulla. As we can see, we're cutting at the level of the medulla. So as we cut through the level of the medulla, we can see that posteriorly we're even going into parts of the cerebellum, the lower parts of the cerebellum, the cerebellar vermis. So this here, the structure that you're seeing here posteriorly, that looks kind of like a butterfly, this is the cerebellar vermis. Then of course your structure number 6 here, which is anterior, is pretty much your medulla. So this is the medulla that you have sectioned over there. Then of course you have your sagittal sinus in that area there at the level of the sectioning of the medulla. So I really hope this is making some anatomical sense. Then we move even a step higher. Now we're going to be cutting right through the level of the pons. So as you can see, we're cutting, this is where the line is, we're cutting right through the level of the pons. So if we're coming posteriorly, we've now moved into the cerebellum itself. We're moving into the cerebellar hemisphere. We're cutting, sectioning right into the cerebellar hemisphere. So this whole large structure here is the cerebellar hemisphere, which is number 8 over there. Then 9, you still have part of the vermis anteriorly. You still have part of the vermis anteriorly. Then number 10, remember that the 4th ventricle is going to be passing through the cerebellum. So this opening here, or this space here, this is the 4th ventricle. It's going to be passing through the cerebellum. Then anterior to this is going to be, of course, your pons. So this structure here, which is structure number 11, which is going to be anterior, is going to be your pons. And remember, anterior to the pons, you have this roundish small structure here, which is known as the basilar artery. So this is the basilar artery. Then of course, on each side, on the left and the right, you have these round circles here, which are going to be your left and your right internal carotid arteries. Then if we still move anteriorly, we have a sinus there, which is known as the cavernous sinus. Then of course, if we now come to here, part number 15, here you have the middle cerebellar peduncle, which is of course connecting the cerebellum to the pons. You have the middle cerebellar peduncle. Then of course number 16 is this internal auditory canal. This is at the level of the ear. Then we'll also get to see part of the temporal lobe, which is structure number 17 over there. So this is the temporal lobe. I hope you're actually absorbing a lot of this information. Then we move even a step higher, where we're now cutting through the folium, or the roof of the cerebellum. So this is still part of the cerebellum here. But at this point now, we're cutting at the level of the midbrain. So it means that structure number 19 over there is going to be the midbrain. So this structure here, this is the midbrain. Then if we look at structure number 18 here, you have the aqueduct of Sylvius, this round circle over there. Then if we move anteriorly, we're now even cutting into the orbit. We're cutting into the eyes. As you can see, this sinus here is your frontal sinus that is in front over there, so which is this dark area over there. Then these is of course the eyes. These are the orbits. So that's where the eyes are going to be found. Then we also look at a little bit of some of the vasculature. So as you can see, this whitish line over there, this blood vessel, that's your posterior cerebral artery. Then of course here number 22 will be your middle cerebral artery. Sometimes it's very good to actually look out for these arteries, because they may sometimes be blocked. You may just be able to see this artery standing out, especially what we call a hyperdense vessel sign. I will talk about it a lot in details when we talk about strokes and all those other issues. Then we move in even a step further, where we cut now at the level of the 3rd ventricle. So this is cutting, so this here is the 3rd ventricle posteriorly here. So we're cutting at the level of the 3rd ventricle. So this is the occipital lobe. Posteriorly, as you can see, we're cutting through the occipital lobe. So this will be your occipital lobe over there, number 23. Then, of course, number 24 here, which right at the center, this is, of course, your third ventricle. Then we come to now number 25. This one now cutting into the frontal lobe over there. So this is your frontal lobe, number 25. And then, of course, 26 is still the temporal lobe. We haven't yet reached the parietal lobe. So this is still the temporal lobe. And remember that between the frontal lobe and the temporal lobe, you have a fissure. So this fissure here is known as your Sylvian fissure or your Sylvian sulcus. So here's another much more detailed thing. As you can see here now is a CT. This is a CT image. So you have the different parts that are labeled there. So just take your time to actually trace whatever you can see on this image, this diagram, to whatever you can actually see on the CT scan. Pause the video at this moment, and I've already talked about them in the prior sections. Then we move even a step higher. We cut now at the level of the thalamus. Again, if we start posteriorly here, number 28 here is your superior sagittal sinus. So this circle here is your superior sagittal sinus. Then number 29 here, you still have the occipital lobe because we're still cutting through the occipital lobe. So at the level of the thalamus, we're still going to be able to see the occipital lobe. Then number 30 here, you have the choroid plexus, which is present within the occipital horn of the ventricles. Then, of course, number 31 here, you have your internal cerebral vein. Then this will be your anterior horn or your frontal horn of your ventricles. That's area number 32. Then this rounded structure that you can see here, as you can see that there's a round structure over here. This is going to be your thalamus. So this round structure here, this is your thalamus. Then number 34, which is obviously this structure over here, is going to be your temporal lobe. Then number 35, because you can see there's this dark area here, that's going to be your internal capsule. So as you can see, this over there is your internal capsule. I don't know if you can see what I'm seeing right now. Then number 36, which is this area here, this is your putamen. So that's where your putamen is going to be, which is part of the basal ganglia. Then number 37, which is close, or rather medial, is going to be your caudate nucleus. So this is your caudate nucleus, which is of course separated from the thalamus by your internal capsule over there in this diagram. Then number 38 is going to be your frontal lobe. So you are still cutting through the frontal lobe in this area. Then we move now even a step further, where we're cutting now at the level of the corpus callosum, which is the tissue that connects the two different hemispheres. So we come again from posteriorly. So this is going to be the splenium of the corpus callosum. Then if we come anteriorly here to number 40, you have the choroid plexus, which is present within the lateral ventricles. So these are your lateral ventricles. Then of course, anteriorly here is the genu. The anterior part is the genu of the corpus callosum. So this is at the level of the corpus callosum. Then we move even a step higher. So this is now going to be at the level of the body of the corpus callosum. We stop visualizing the ventricles. So all we see here is the parietal lobe. Actually, the parietal lobe, this one, we're no longer seeing the occipital lobe rather. We're now seeing the parietal lobe. So past this level, as you can see here, we can see part of we can see part of the occipital lobe, even here, just the superior part of the occipital lobe. But once you reach the level of the corpus callosum and above the corpus callosum, we stop visualizing the occipital lobe. What we're going to be visualizing posteriorly is the parietal lobe. So all this is the parietal lobe. Then here is of course your body of the corpus callosum, and of course you still see the frontal lobe over there labeled 44. So here's now the sagittal section with the different numbers of all that. I think we have had a look at all these things. You can actually trace them and map them out. I've put these indicators to help you actually visualize this. So you can actually pause this video at this moment and actually have a look at this. Same thing with this image, which is a coronal section. Another coronal section, and I think it's self-explanatory from this point. Here's another section as we're moving anteriorly. And here's one now with the different blood vessels that we have. So have a look at the circle of Willis and the vasculature inside the brain. Have a good understanding of that. Then you'll be able to understand this diagram very, very well. Here's another MRI image with, of course, the different types of the cystins. You have the suprasellar cystin over there, and of course you have the pontine cystin over there. So coming back to our warm-up question, the classic pattern of chronic ischemic stroke on CT brain image is A, hypodense lesion with dilated ipsilateral ventricle, B, hypodense lesion with dilated contralateral ventricle, C, hypodense lesion with midline shift, D, hyperdense lesion with effacement of the corticosulci. Remember that in a chronic ischemic stroke, there's going to be liquefaction of tissues on the side which is affected, so it means there will be loss of volume on that particular side. So the ventricle on the same side will be dilated, and because it's a chronic thing, it's going to appear hypodense. So that's going to be your answer, which is option A, a hypodense lesion with a dilated ipsilateral ventricle. I really hope you enjoyed this video. If you did, consider subscribing to the channel, hit the bell notification icon to be receiving notifications of such videos every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Happy New Year once again. Until next time, bye-bye.